Welcome to the deep dive. Today we're tackling something that sounds pretty complex, wide QRS complex tachycardia in children.
Yeah, it's a mouthful, isn't it? But don't worry, we'll break it down. We're taking what you found and up to date and making it make sense.
Exactly. It's like taking a crash course, no exams required. We'll unpack the medical jargon, dive into diagnosis, treatment, and what it all means for a child dealing with this.
Think of it as like translating a dense medical journal into something you could enjoy with your morning coffee, you know. Still engaging,
Yeah,
but way easier to digest.
I like that. Now, the up-to-date excerpt you shared is super detailed, so we'll focus on the most important, most interesting stuff.
The aha moments.
Right, exactly. So, first things first, what are we even talking about when we say wide QRS complex tachycardia?
So imagine a heartbeat, like a wave, right, on a monitor, an EKG. Now, picture that wave wider than usual.
Okay, I'm picturing it.
That's the wide QRS complex part, a visual clue on the EKG that something might be up with the heart's rhythm.
A blip on the radar.
Exactly. And then we add in tachycardia, which just means a faster than normal heart rate.
Okay, and this is where it gets interesting, right? Because not all tachycardia is the same. The source makes a clear distinction: ventricular tachycardia, or VT, and supraventricular tachycardia, SVT. Why is it so important to tell the difference?
Well, it all comes down to where the rapid heartbeat starts. VT, that means the issue's coming from the ventricles, the lower chambers of the heart, the ones that pump blood out to the body. SVT, on the other hand, that starts in the upper chambers, the atria.
So two different starting lines for the same race.
Yeah, exactly. And just like different starting points change how you run a race, knowing where the tachycardia starts, VT versus SVT, that's critical for effective treatment and for understanding what the long-term outcome might be for the child.
And I noticed this up-to-date excerpt doesn't waste any time. It jumps right into what to do if a child's experiencing this type of tachycardia. What's the absolute first thing, the most crucial action to take?
You have to assess their hemodynamic stability. Basically, we're figuring out if their blood circulation is good enough to keep their vital organs working properly.
So it's not just about how fast the heart's beating, but also if that rapid rhythm is impacting the body as a whole.
Exactly. A stable patient might just need some medication,
Yeah.
but for someone whose circulation is compromised, their organs aren't getting enough oxygen-rich blood, that requires more urgent action.
And the source lays out a few different scenarios depending on how serious the situation is.
Yeah, three main ones: cardiac arrest, an unstable patient, and a stable patient. Each one needs a slightly different approach, and often, you need to act fast.
So let's break this down a bit. First, the most critical, cardiac arrest.
In that situation, every second counts. The heart stopped effectively pumping blood, the child will be unconscious. Immediate CPR is absolutely essential, following a specific protocol for kids experiencing cardiac arrest.
Wow, it's like a race against time to get the heart going again, get that blood flowing. Now, what about an unstable patient? They've still got a pulse, but their circulation is compromised. What needs to happen there?
Speed is key again. You're looking at their airway, giving oxygen if they need it, and getting an EKG reading ASAP to see what the heart rhythm's doing. If the EKG shows a wide QRS complex, which could mean VT, synchronized cardioversion is often recommended.
Synchronized cardioversion, that sounds intense.
It can be. It basically means giving a controlled electrical shock to the heart to, try to reset its rhythm back to a normal life-sustaining pace. Really critical, especially if you're thinking it might be ventricular tachycardia.
So, okay, we've dealt with the immediate crisis. The patient is stable. We can breathe. Now what?
Well, now we switch from crisis mode to detective work, right? We need to figure out what caused this rapid heart rate in the first place.
Yeah.
Time to do some medical sleuthing.
And like any good detective, we need clues. What are the crucial pieces of information needed to solve this medical mystery?
Well, a thorough medical history is key, like interviewing witnesses, right? You want to know about the child's symptoms. Did they feel their heart racing? Were they dizzy, lightheaded, any chest pain?
So much can be revealed by those subjective experiences.
Absolutely. And we dig deeper into family history. That's crucial. Any history of sudden cardiac death in the family, especially at a young age. Any known inherited heart conditions.
Looking for genetic predispositions that could be contributing.
Exactly. We need to know about any medications they're on.
Even over-the-counter stuff like cough syrup.
Oh yeah, even seemingly harmless meds can sometimes mess with heart rhythms. And of course the EKG. That's a star player in this investigation.
Our peek inside the heart's control room, what are the cardiologists looking for on the EKG to differentiate between VT and SVT?
They're looking at the shape, the size, the timing of those heart waves. Like, they'll look for something called AV dissociation, meaning the top and bottom chambers of the heart aren't beating in sync. There's a
Right.
big clue pointing toward VT.
Like two dancers that are supposed to be moving together, but they're totally offbeat.
Perfect analogy. They'll also look at the heart's electrical axis. Think of it like the heart's compass, the direction of that compass needle can be off in VT.
So many clues hidden in those electrical signals. And with all this info, the doctor can hopefully figure out what's causing the tachycardia and come up with the treatment plan.
Exactly. And that's where that crucial difference between VT and SVT comes in. Because the treatment isn't one size fits all, right? It's got to be tailored to the specific diagnosis.
Two different paths, two different treatment strategies. What about VT? What are some of the ways to manage that?
So with VT, the approach really depends on what's causing it and the child's overall health. Sometimes just fixing an electrolyte imbalance, like low potassium, can be enough to get the heart back on track. Other times, you need medications to regulate the heart rhythm, antiarrhythmics.
Like fine-tuning the heart's conductor, making sure the orchestra's in sync.
Yeah, exactly. Now, for some types of VT, medications like calcium channel blockers, which relax and widen the blood vessels, can be effective. But others might need more powerful antiarrhythmics, things like lidocaine or amiodarone.
Each medication is like a different tool in the cardiologist's toolkit.
Exactly. And choosing the right tool, well, that depends on a lot of factors specific to that child and their condition.
Makes sense. Now, our source mainly focuses on VT, but it does mention that for stable patients with SVT that's causing a wide QRS complex, they're managed similarly to other SVT cases.
Yeah.
Can you expand on that a bit? What are the typical treatments for SVT?
Sure. With SVT, you're often trying to interrupt that rapid electrical circuit that's making the heart race. Vagal maneuvers are often the first thing we try.
Vagal maneuvers, what are those?
They're basically simple, safe techniques to stimulate the vagus nerve, which helps slow the heart rate down. A common one is the Valsalva maneuver, where the child blows out forcefully while holding their nose and mouth closed.
Like trying to inflate a stubborn balloon.
Yeah, exactly. And, it's surprisingly effective in a lot of cases. If those maneuvers don't work, then medications like adenosine might be given intravenously to quickly reset the heart rhythm.
Like hitting the reset button on a computer that's gone haywire.
Exactly. And if those initial things don't do the trick, other medications like beta blockers or calcium channel blockers might be used to control the heart rate and prevent future episodes.
It's amazing how each intervention targets those electrical signals in different ways. Okay, so let's say the tachycardia is gone, the heart rate is back to normal, everyone can relax a bit. What happens next?
Well, treating that immediate episode, that's crucial, but it's only one piece of the puzzle. We have to figure out why it happened in the first place. That's where the real detective work comes in.
So the investigation continues even after the crisis is averted.
Oh, absolutely. The next step is to do a full evaluation, rule out any underlying heart conditions that could have contributed to the tachycardia. We don't want any hidden culprits lurking in the shadows.
It really is like a medical CSI, but for the heart.
Exactly. We've got all sorts of tools to get a good look at the heart's structure and how well it's working. Echocardiography, for example, that's kind of like giving the heart an ultrasound.
Oh, interesting.
Yeah, it uses sound waves to make these detailed images so you can see things like, are there any problems with the heart muscle itself, the valves, the chambers.
Wow, so it's like seeing the heart's blueprint in action.
That's a great way to put it. And sometimes what we see on the echo might mean we need to do some more testing. Like a Holter monitor is a good example. It's like a heart diary.
A heart diary.
Yeah, the child wears it for a day or two, and it keeps track of their heart rhythm the whole time so we can catch any weird blips.
So if the tachycardia is being sneaky, the Holter monitor can catch it red-handed. I like that.
Exactly. It helps us figure out, are these abnormal rhythms happening a lot? Or just every now and then? Or maybe only under certain conditions?
This is all so fascinating, but I imagine it's got to be overwhelming for the child and their family, right?
Right, absolutely. It's so important to remember the human side of all this.
Yeah.
It can be scary to get a diagnosis like this. And families, they need support. They need clear explanations. They need hope.
Oh, absolutely. And I know our source really focuses on the medical aspects, but that emotional well-being of the child and their family, that's huge.
Couldn't agree more. And that's where the medical team's expertise, but also their compassion, that's so important. Guiding families through this whole process, reassuring them, helping them make informed decisions about their child's health.
Speaking of decisions, let's talk about the long-term management of this. So the initial treatment and evaluation are done. Does every child need some kind of ongoing intervention?
That's a great question. And the good news is, not always. Our source actually points out that a lot of kids, especially the ones without any other heart problems, they do really well. The arrhythmia might just fade away over time, or it might happen less often.
So it's not always a case of like needing medication or procedures for the rest of their lives.
Right. But, and this is important, close monitoring is key, even if that first episode seems to resolve on its own. Regular checkups with a pediatric cardiologist, those are crucial, just to make sure the arrhythmia isn't causing any silent problems and to adjust the management plan if needed.
So staying vigilant, even when things seem okay on the surface.
Exactly. And that's where those regular echocardiograms we talked about, those are really helpful. They let us keep an eye on heart function, catch any subtle changes early on.
Like taking your car in for regular maintenance, making sure everything's running smoothly.
Perfect analogy. And for some kids, those checkups might be all they need. But for others, we might need to be a bit more proactive to prevent future episodes and protect their heart health in the long run.
Our source mentioned things like catheter ablation and implantable cardioverter defibrillators, ICDs. When might those options be on the table?
Okay, so catheter ablation, that's kind of like a tiny rewiring procedure.
Oh,
We use heat, or sometimes cold actually, delivered through a catheter to make these little scars in the heart tissue. And that disrupts those faulty electrical pathways that are causing the arrhythmia.
it's like fixing a short circuit in the heart's electrical system.
That's a great way to think about it. Now, ICDs, those are a little more involved. It's a small device, goes under the skin, and it constantly monitors the heart rhythm. So it's like a bodyguard for the heart, always on duty.
I like that.
If it detects a life-threatening arrhythmia, it gives a controlled electrical shock to reset the rhythm back to normal, like having a backup generator,
Yeah.
just in case the main power source goes out.
It provides that extra peace of mind, knowing there's a safety net.
Exactly. But, the decision to do ablation or to implant an ICD, that's not something we take lightly. It's a big decision made together with the child's family, thinking about their individual needs, their values, the overall risks and benefits. It's all about finding that balance.
Managing the condition, but also making sure the child can still live their life to the fullest.
That's it. We want these kids to thrive, to know that they have a whole team of experts in their corner, supporting them every step of the way.
This has been a really incredible deep dive. We've learned a lot.
My pleasure.
Before we wrap up, any final thoughts for our listeners about wide QRS complex tachycardia in children? What are the key takeaways?
If you ever notice your child's heart racing a lot, or just anything unusual with their heart,
Yeah,
don't wait. Get it checked out. Early diagnosis and treatment are so important.
absolutely. And even though this condition might sound scary, with the right medical care, a personalized treatment plan, and ongoing monitoring, these kids can live healthy, active lives.
I couldn't agree more. Knowledge is power, right?
Yeah.
And the more we understand about this condition, the better we can advocate for our children and navigate the world of pediatric cardiology with confidence.
Thank you so much for being here today, for sharing your expertise. This has been incredibly informative and empowering for us, and I hope for our listeners as well. And to everyone listening, remember, you can always revisit this deep dive or share it with someone who might find it helpful. Until next time, stay curious and keep on learning.